Some shocking health stats out today. Us West Aussies, we're not in good shape when it comes to our health. New WA health statistics show smoking rates are growing. Our screen time is up, which means we're sitting on our backsides far more than we should be, and we're not eating enough fresh food. Let's break it down with AMAWA President, that's a mouthful for you, Kyle Hoath, who's good enough to join us on the program. I got it out eventually, Kyle. Good morning to you.
No, you got there. Good morning. How are you?
Can you run through some of these numbers? Let's start with smoking. I can't believe that the rates of smoking have gone up.
Yeah, and gone up for the second year in a row as well. So up a whole percent, which is definitely on the concerning side. You know, we've seen pretty good traction over the last couple of decades around reducing that number. So not a great trend to see it go up again.
When it comes to physical activity, just how bad are we at the moment?
Yeah, look, interesting. I think the physical activity and exercise is not horrendous, but the weights of the unhealthy weights and the unhealthy diets are not looking too good in those stats. I think particularly around the consumption of fresh fruit and vegetable, sitting sort of abysmally low. And look, a lot of that I think is chalked up to the cost of just how expensive it is to eat healthy at the moment.
So just going back to physical activity, what is the recommended physical activity for your average person on a day?
Yeah, I guess you find 30 is a good place to sort of start. Most people should be trying to get 30 minutes of some form of exercise, even if that's just getting up and going for a walk. But as you said, with screen time being so high and with so many of us having jobs behind desks, I think a lot of West Australians struggle to get any kind of exercise.
I understand that problem. The data, how is the data compiled? Where did the survey come from?
It's run by the WA government, so it's a combination of census data and surveying of people out there in community, but also looks at some statistics from our clinics and population health units. So it's fairly robust.
So you mentioned before cost of living having a factor with our food choices. What ways can we try and solve this issue, do you think, Kyle?
Yeah, look, I think it's a really tough one because it's not a new problem. Fast food being the unhealthy option has always been cheaper, and I think as we're seeing the cost of living crisis get worse, it's getting more and more expensive to eat healthy. And so I'm not really sure what the solution is there. I mean, people know that eating fruit and veg is important. People know what eating healthy is like, but I don't think it's just an education piece. I think it is there's got to be some sort of strategy around making that an affordable and accessible option for West Australians.
AMAWA President Kyle Hoath is with us here on Breakfast at 7 on 720 ABC Perth and ABC WA. In your opinion, Doctor, what is the most concerning of the stats here?
Hard to pick one. The smoking being up again, the sort of maintained high levels of risky drinking, which I think sit at over 30% still, and the number of people who are missing meals because they can't afford food are probably the three that really jump out to me. I mean, the 8% of West Australians, skipping meals because they have run out of food, that blows me away. That's something that we absolutely need to be targeting as looking after all West Australians, right? That's just sort of on that verge of completely unacceptable.
Yeah, and we've spoken about this with the amount of people that are still looking for public housing. It's expected to be up to 25,000 people. That this is a rich state. We've got a top credit rating. People have employment, and yet we have these really worrying figures of people in genuine trouble in our state.
Yeah, genuinely not eating because they can't afford to, and I think that's we're better than that, and I'm with you. I think we're a wealthy state, and we've got resources and a community that does like to come together and support one another. So anything we can do, I think, to try and find some solutions around that, which is like I said, I don't think this is just an education piece. I think there's definitely that sort of, you can see that financial strain really, really starting to impact our health, not just our sort of, other parts of life that we tend to associate money with, but I think really it's starting to hit our health.
Last one for you, and I'm curious just your thoughts on this. With smoking rates going up, I grew up in a time where the number of anti-smoking ads were absolutely everywhere. I thought we didn't require that sort of educational process anymore. Is it time now to perhaps try and ramp that up again?
Yeah, I think with smoking it is. I think there's a couple of challenges there with smoking, with both the illicit tobacco trade and obviously the vaping craze of recent history. We did see vaping numbers go down slightly, which is positive, but we need to make sure that we're keeping people informed around the dangers of smoking, so that we're not putting people in that position where they are quite literally killing themselves. So we need to make sure that people are aware. Nothing's changed with smoking. I'm with you. I remember a lot of the quit campaigns and ads growing up, and we don't see that as much anymore. But maybe it's time that we reinforce that message.
Hey, mate, WA President Dr Kyle Hoath, thanks for talking to us on Brekkie.
My pleasure. Take care.
Good on you.